Welcome to the PinkpillRx podcast, hosted by Katie and Jay Fillmore, where we navigate complex and thought-provoking topics surrounding women with a focus on education. For shorter form content, follow us on TikTok, Instagram, or YouTube at Caters88 or PinkpillRx.
That's Kators 88.
If you enjoy this podcast, please give us a follow and maybe a nice review.
We have an exciting announcement specifically for YouTube. So many people have wanted longer form content, like video content that makes it easier to watch the topic series. You know how we cut things up into series, and it's pretty, they're like 1.5 minute long segments like on TikTok or Instagram. So in these YouTube videos, I'm putting these series all together so that you can watch them in chronological order, and I'm putting them in 30-minute YouTube video segments. So if you are interested in that, you can watch on our YouTube playlist. Long Form Pink Pill Series is the playlist name. There's also a 2-hour, 45-minute long video that you can buy that covers our content from April of 24 to October of 24. That's available on our Etsy shop for $10. We also have a Pinkpill Game on our Etsy shop. If you use the promo code podcast, you can get that for 20% off, and that would apply to any of our Etsy shop items. That promo code is good through the end of April. Other ways you can support us is subscribe and follow this podcast, leave a podcast review, subscribe to our Patreon, and even send us topic ideas. Even better if they come with sources. And lastly, just sending us encouragement is always appreciated. Your kind words go a really long ways. Okay, it's story time. I want to give some voices to some stories that have been shared with me. And if you are one of the people who have shared stories with me and I've not responded to you, I want to profusely apologize. That is, my intent is not to overlook your stories. I do read all the stories. I don't always have time to respond to them. But this story was sent to me talking about a medical procedure that this woman had done, called a uterine ablation. I'm assuming, I don't want to assume, but I'm assuming you don't know what that is.
I do not.
Okay. So it's a procedure that destroys or removes the lining of the uterus, so the endometrium, and it's done to reduce or eliminate heavy menstrual bleeding.
Okay.
And an ablation can be achieved through various methods. The methods that I've heard most about are heat. So it's like really high heat via radio frequency, heated saline, or like microwaves. Not like a microwave, but microwaves.
Yeah.
Or they can use extreme cold. It burns that inside uterine lining away so that, because like during your period, that lining sheds. Mm-hmm. And so by burning down the endometrium, then you're not going to have that heavy bleeding because you're not going to have that uterine lining.
Right. Do you have to do that every cycle?
You don't have to do it every cycle. It lasts. So she decided to have this done. I'm going to read it as first person because it's written in first person. And I'm going to call the doctor's name Dr. X because she wanted the doctor to remain anonymous as well as herself. So my mother-in-law brought me to the office, and I took the diazepam I was given right at 3 p.m. as the doctor had advised me to. Now, diazepam, as a reminder, it's an anti-anxiety medication. It's a benzodiazepine. So It's supposed to help with anxiety. That's what she's getting for this procedure, and that's not abnormal. Dr. X came out to the waiting room around 3:05 p.m. and got me herself. She took me into a separate room and gave me a shot of Toradol. Okay, so Toradol is an anti-inflammatory medication. So it's like ibuprofen's big brother.
Okay.
She asked me to wait for the medicine to take effect. I joked that she was going to wait for me to drool all over myself, and then she left. I sat in the room and felt a little loopy for reference. I still felt pain in my ankle when I rotated it, which had been overused a few weeks before and was still sore. I think I was in that room for about 10 minutes. I was brought into the procedure room by an older nurse whose name I do not remember and I am not sure I was given. At this time, I was handed the consent form to sign, which I did. Nothing was explained to me at that time. She just said, "This incorporates everything that has already been explained to you by Dr. X." When Dr. X entered the room, I was already on the table, and she asked me how I was feeling and if I was ready. She said she was disappointed to see that I was not drooling all over myself, referring to the joke I had made in the first room. I advised that I was definitely feeling the drugs, but could also still feel the pain in my ankle and was a bit nervous. She said that it was normal and okay to be nervous because she was going to give me, and it was okay because she was going to give me something internally, and that would take care of the pain. She gave me what felt like 3 jabs with a needle down there. Dr. X's notes state, a speculum was placed in the vagina and the anterior lip of the cervix was grasped with a single-tooth tenaculum. A paracervical block with lidocaine epinephrine was injected. When the procedure began, it was sort of similar to a yearly exam, just some pulls and tugs in uncomfortable spots, making me overall uncomfortable, but not painful. Then it started to get painful, and Dr. X explained that she was having trouble dilating me. She advised that my body was being difficult. This was painful, but not unbearable at this point, and she let me know when my body finally dilated. Dr. X's notes state, the cervix was progressively dilated, end quote. Then Dr. X told me that she had just realized that my uterus was tilted and that angle was all wrong. At this point, I was much more uncomfortable than earlier and in a decent amount of pain. I started to do Lamaze breathing. The nurse noticed and said out loud, "Aw, you're in pain. It's okay," in a condescending way and did nothing. Then Dr. X told me she was having trouble getting inside and that this next part was going to be painful, and it was. It felt to me like she had to break through a barrier, and it was super painful, and she asked if I was okay after the second try. It felt like she had to take 3 tries at what she was doing, then it broke free. In the middle of that, I was breathing a bit heavier, and the nurse said again what became her only words in what seemed to me was a very condescending tone. "Aw, you're in pain. It's okay." It was said out loud, so both the doctor and the nurse were aware I was in a decent amount of pain at this point. Dr. X's notes state, the uterus was a bit retroflexed so that there was some difficulties getting into the internal cervical os. A hysteroscope was used to hydrodilate the internal cervical os. I was able to enter the uterine cavity. After the quick pain came a pain inside that I would equate to a re-injury of a bad knee scrape. It hurt decently when she broke through and then continued to hurt afterwards as if she was continuing to do whatever she was doing to break through. I said out loud that this really hurt and recoiled slightly on the table, but quickly realized it wasn't her actions anymore. Again, the nurse said, "Aw, you're in pain. It's okay." I was unhappy and getting exhausted from the pain at this point. It was not going as planned. The nurse was highly agitated. I was scared because all this had been decently painful already, and I knew the part the doctor had originally explained would be the most painful part was still yet to come. Dr. X was stating what she was doing as she was doing it, but never asked me about my pain after the one time she asked if I was okay. No one at any point offered me any further pain medicine or checked my vitals. At this point, the actual ablation was about to start, and we had hit and exceeded my pain tolerance. So this is all before they start inputting that hot stuff. And I started to mentally check out a bit as a coping mechanism. When the ablation device went in, it was so painful, I am not sure I can put it into words. I recoiled on the table, and there was nothing to recoil from since it was in my body. It was hot like lava once inside and continued to be as it came out. I believe I said, "Oh my God," out loud. The doctor started telling me just a little longer, but it felt like the longest 7 minutes of my life while my insides boiled and charred. There were places where it internally tugged and tore while being molten, and I thought for sure my vaginal extremities were burnt to a crisp on the way out. At the time, I knew she had lied to me about the duration of the procedure. I didn't know it was specifically 5 minutes more than she had said it would be. The procedure did not last the 120 seconds she had told me it would. I find the last sentence in her notes insulting, which the last sentence was, she overall tolerated the procedure well. I find that last sentence insulting. I wonder if I had screamed if she would have still written the same thing, and if I had less politely been in pain if she would have actually done something. She wrote a poem about this as well that I want to read to you. This is called Valid Normal Suffering. Have you ever had your body warn you, place heavy anxiety on your chest, screaming with unknown reasoning, and regret not listening to your intuition? Have you ever been in a safe place with those who were more educated, people with large degrees and licenses, people who spent a long time in school, made to feel that safety with words, told that what is going to come is normal? A slightly painful procedure for a short time, but it will solve your problems with finality? Have you ever felt unexpected pain, the kind that melts through your skin and then climbs higher and higher, unrelenting? A heated fluid destroying while lava-like and hot. In the most intimate areas of your body, have you ever had a procedure you couldn't stop, even though the agony was intolerable and searing, because the outcome was heavily needed and the procedure was completely inside you? Have you ever needed to tell your brain, I have to do this, at every level of hurt, determined to get through this normal pain, internally chanting over and over, I can do what others have done? trying to will yourself to adjust to the pain and be strong. Have you ever been in so much pain that the reaction is automatic? Your body physically and aggressively rejects the affliction and tries to pull you from it by pulling backwards in one motion, but it cannot be removed because the suffering has been placed inside you. Have you ever felt a level of betrayal that washes over you like a wave? Once the pain is left and your head is clear and you process the normal, once the brain computes what normal was for you specifically, and it is other women who stand there in their betrayal as if it was normal, because the pain was undermanaged and underacknowledged, while they stood by and watched savage char to your body be delivered, and alarm bells shrill as you say out loud, "That fucking hurt." Have you ever realized that you went through excruciating pain without reason, trying to place steel walls up against the avoidably tragic memories? But the wall is weak, and your dreams become nightmares, and then crying that cannot stop, that is in no way normal, and eventually turn to enraged anger that overwhelms. I have, and many others have too. It is suffocating in its mass alarm and overwhelming sadness, because you realize in that moment that you are not alone. Because if you are a woman, your pain isn't viewed valid, deemed the normal way to perform procedures on women, because the normal medication to ease suffering is barely any. This normal from research done on men without female organs. We need to challenge what has been the normal. Waste no time letting the status quo take any more from us. Purpose and meaningful change will help us step away from the normal and to finally treat women like human beings instead of replaceable property. How traumatic.
Dude, I am shocked. There was a woman nurse and a woman doctor.
Yeah.
Toradol?
To get your uterine lining burned away.
Didn't they give you Toradol after your C-section? It wasn't nearly enough of anything?
They did give it to me, yeah. And it was not as helpful as I was hoping it would be.
Yeah. And then not doing anything to address pain when she's expressing it. And that condescending "Oh, it's okay. That's what you say to a 2-year-old. This is a grown adult."
Yeah.
Dude, the pain management stuff. We did an episode on that before, didn't we?
Mm-hmm. I'm going to read you another story.
All right.
So this is in response to, do you remember the episode we did on Brooke Shields?
Yep.
Okay, so this is after that episode. The person writing in says, "This isn't something I've ever talked about publicly. I don't have an audience anyways, and I'd like to stay anonymous because of my career. I'm going to just type all of it out. I feel like the full picture really shows just how little I was listened to, and also my brain is too fried after work to make it more concise. I haven't told this story in 9 years. I have a disorder that makes me grow cysts, and the same disorder leads to severe scarring. I end up with marble-like scars on my vulva and labia, which makes it painful to sit, wear pants, lay in certain positions, and walk. I went in for a labiaplasty to get some of the tissue removed to reduce the pain and discomfort. I signed a consent form that said labiaplasty bilateral. I was awake going into the OR and asked to stay awake for the timeout procedure. I once again confirmed that my surgery was to be a bilateral labiaplasty. I also reminded them for the third time, parentheses, pre-op appointment the week before, pre-op room an hour earlier, then in the timeout, that my skin does not dissolve the dissolvable sutures and that they would have to use normal ones and to leave long tails on the sutures because my skin rapidly grows over sutures. I was told I would need 1 week off of work and would have 10 sutures. I was having so much pain and bleeding the first few days after that, and it just didn't make sense for what surgery I had done. I finally used a mirror to look at my vulva, and my vagina was swelling outward. I went in for my post-op appointment and said, "You did a different surgery than you told me about." And the resident, who I had done all my pre-op with, barely nodded yes. She left the room to get her attending. Parentheses, I had never met the attending before surgery, but she was the one with my resident for it. End parentheses. They were very, very careful with their language. They never verbally confirmed they did a different surgery. They said I had sutures internally and externally. Over the next 5 weeks, all of which I had to take off work instead of the 1 week they had originally told her, I had to go in, parentheses, they gave me different residents from then on, end parentheses, and get sutures cut out of me. Over 40 sutures instead of 10, and they had used dissolvable, which don't dissolve for me. And they cut all the tails off. I got endless lidocaine injections in my vulva and vagina so they could cut the sutures out with a scalpel. The tails were poking out of my skin. So, After healing from surgery, they had to cut me back open so I could heal again. One of the times after a male resident cut a suture out that he didn't believe me was there, he said, "Now I believe you." Oof. I did have one wonderful resident who did the majority of my suture removals. Very fucking kind. He verbally confirmed I had a different surgery. I didn't meet him until a couple weeks after this surgery. And he told me that what it was called and detailed that they took out part of my pelvic floor.
What?
And that I had an episiotomy. He actually subtly told me how to file a formal complaint against his own colleagues in hospital. Green flag resident.
Yeah.
I filed a complaint. The response was, technically a wedge resection is a type of labiaplasty, so it is covered under the consent you signed. I would think that informed consent would mean that they had explained the surgery to me and all of the surgery, but I literally did not even know it was a thing until weeks after they did it to me. I wasn't even informed until long after they had already done it. I reached out to the best lawyers in my area, but they all turned me down. Not only would I have to prove that the surgery caused me $250,000 worth of damages, parentheses, apparently pain and lifelong complications and simply the violation of my body weren't enough, end parentheses, but I would also have to prove that if my surgeon had offered the pelvic floor wedge resection surgery to me, I would have said no. I would have had to prove a thing that did not happen in like 3 different ways of not happening. The other problem is that the hospital aligned itself with the state I live in, so you technically have to sue the state. The statute of limitations was 3 years. Maybe by now I would have had enough ammo for a lawsuit, but who knows? My surgery was 9 years ago. I was 25 years old.
Oh.
The whole point of the surgery boiled down to the painful external scars. Instead, I got wild external scars and a ring of tight scars inside my vagina. I still get pain, like fetal position pain, and can't take a deep breath pain. I have incontinence. I have slight vaginal and rectal prolapse. I am still in pelvic floor physical therapy. I'm now 34. I'm not going to have kids. Otherwise, I'd be terrified of how everything would tear open. While we're on that subject, I could die if I get pregnant. Same condition that causes the cysts and scarring. But no doctor would remove my fallopian tubes until I was 29. I finally found a badass female surgeon who was 8 months pregnant when she did my surgery. She's an angel. I don't know how it was a female resident and female attending who did this to me. A thought I had is that maybe because it's a major teaching hospital, one of the top in the country, the attending saw me as an opportunity to show her little resident an uncommon surgery. Who could possibly know their reasons? I just can't figure out why a woman would do this to me. I never met the attending until my post-op appointment. So anyway, that's my story. I'm basically Brooke Shields. I'm going to run with that. Yeah. Thank you for posting about her surgery. I had no idea this could just happen to someone else. And thank you so much for the work you put into your channel. It makes me feel seen. I know many, many people feel the same. Thank you for your husband as well for setting the most solid example for other men. So much suffering.
Yeah. Gosh, that is... I almost feel like using words for that would be irreverent because I don't have words that I can really think of to express the horror. Because she's got to live with that. She's got to live with that forever. No compensation for it. It's been 9 years. She's still in PT, and they took out part of her pelvic floor.
Yeah.
And she's got prolapses. There's a certain word I'm looking for. Like, they destroyed part of her body forever.
Yeah.
Like they cut out part of her pelvic floor and threw it away as medical waste.
That's exactly what
They
happened.
mutilated her.
Mm-hmm. It's interesting that both these stories had female physicians.
Yeah. Yes, it is.
I'm going to read one more story and then we can wrap up.
Mm-hmm.
Sound good?
Mm-hmm.
A trigger warning, this is about childhood essay, so just know that moving forward here. I want to thank you sincerely for your podcast. It's so affirming, and hearing the stories other brave women have sent you and the wonderful way you handled them makes me want to share my own with you. Even if you don't end up talking about it on the show, I want to share it with you because I've never really felt comfortable enough before to share it, so thank you again. When I was 13 to 14, I was sexually assaulted repeatedly by several boys I went to school with. One of them was my age, while the other two were 17 and 18. It was continuous. It escalated, and it made me feel terrified to go to school every day. One of them sat next to me in class every day and shoved his hand under my skirt. I always tried to fight him off, and I never managed. He was much stronger than me, and whenever I fought him, he got more and more aggressive. I was scared and embarrassed to say anything. One time when he was assaulting me, I slapped him, and he responded by choking me until I nearly passed out. They'd take me behind the school and tear my clothes off, rope me so hard they often left bruises on my body, trap me, finger me hard enough to make me bleed. I never said anything, but it wasn't hidden either. People saw it every day and said nothing. The worst example of this was the day the older two boys caught me trying to get on the school bus home. They blocked me, backed me off the bus, threw me up against it, and raped me with their hands. I know legally it may not be rape without a penis involved, but trust me, it feels like rape. I tried to free myself to no avail. People watched this happen, but nobody did anything. The only person who ever even mentioned it to me was another boy trying to use it to blackmail me into sending him nudes. I was entirely alone. It's now 11 years later, and I'm still traumatized by it. But I also don't feel like it would be taken seriously if I did speak up. Recently, one of these boys, now men, messaged me on Facebook, while another sent me a friend request. I don't know if it's worse to think they are doing it to make me feel afraid or uncomfortable, or to think that they don't even remember it or consider what they did wrong to me. Thank you for letting me tell my story, even if it is just a jumble of words.
I can't believe people stood by.
This is why we say that it's better to yell fire than help.
Yeah. Oh, it's enraging, man. Just freaking watch. Someone try to blackmail her for it. That's freaking unbelievable.
Yeah, that is. Thank you for sharing your story. I am so sorry that happened. And that absolutely is rape. That absolutely is something that people should have cared about. And those men deserve to be held accountable for that.
Yes, absolutely. Unfreaking believable. Yeah, I am so sorry that happened. I'm so sorry nobody helped you.
And then they're trying to request to be friends.
Yeah, what the? What?
I hope that you are in a safe space and have found a way to find some healing on this journey, because that would be a lifetime of trauma. Like, that's a lifetime of trauma. Rightfully so.
She deserves to take up space with her pain from that.
13, 14 years old.
Yeah. We're about to have a 13-year-old.
I know.
You know, I'm not a violent person. You know that. And I think everybody who knows me from this can surmise that. But it makes you want to know who these guys were. Because I'm enraged where I want to just beat the tar out of them.
Yeah. Yeah, that's not okay.
Particularly the one that put in a friend request and the one that sent her a Facebook message too.
Unbelievable. Thank you for sharing and putting a voice and putting a voice to childhood sexual assault.
Yeah, and it's very brave to share something so personal and hurtful that happened to you.
Yeah. Those are the stories I have for you. I have more stories for another time, but those are the stories I have for you today, and I appreciate your attention to them.
And these are just a few stories. You get tons of them.
Yeah, this is just a couple of the many, many stories. In fact, I have 46 pages of stories copied and pasted into a document. 46 pages.
The world that I live in is not the one I used to think I lived in. Let me rephrase this. I do not live in the world I thought I did. Because like these types of things are like in the commonplaceness of them is not something that I was aware of before we started doing this. So now I see the world as more for what it is, and it's disorienting because like not knowing these things and then hearing about them and hearing stories and statistics and everything. Yeah, I don't live in the world that I thought I did. All the stories and all the statistics, like it. The rage I feel about situations like the stories that were shared brings up this like very strong, probably more base instinct feeling of like, I want to fight and really hurt somebody. And I don't get that way. But my point though is not that. My point is that's the base instinct men should have, not like oppressing a woman or feeling enraged that you were rejected or getting aggressive. Like that deeper, more base instinct should be like for protection and sending a message to people like that. You know what I mean? There's a lot of talk about toxic masculinity, and that type of language, since it's in the negative, can make men feel more alienated. But if there's also conversation about healthy masculinity, that's more inspiring, that's more including, it's more celebrating things that are innately part of yourself. And then I think there needs to be more talk about what healthy masculinity looks like, and not only what toxic masculinity looks like. I think you got to talk about the toxic stuff, but I think you also have to couple it with talking about the healthy stuff. Otherwise, there's almost like men can feel a lack of inclusion.
Yeah.
You know, because there is a lot of healthy stuff too, but
yeah.
I think that needs to be fleshed out, talked about, celebrated, that type of stuff.
Thanks for hanging out with us today.
Thanks for spending time with us today and for holding space for these stories and these quotes and the conversation we had around it. It was a pretty heavy episode today, but it's important to hear these voices. So thank you for being with us today. I hope for those of you listening, something was intriguing or sparked a curiosity, or you felt affirmed or challenged. Stay educated. Take the pink pill. If you enjoyed this podcast, please give us a follow and maybe a nice review.